Hey guys, Elliot here. Um, Yesterday I posted something about what is fascia and how it is the connective tissue that helps kind of keep the shape and form of our body. And I just wanted to reiterate on one little detail and maybe a couple more little details um, about how we can understand nerve impingements and trigger points, but we can't understand how fascial pain can be referred in different parts of our body. So recently I had a client who had some pain in the outside of their elbow, and my reductionist brain immediately went to um, tennis elbow or that lateral epicondylitis or overuse strain from just constant gripping and twisting activities. And then I took a step back and I said, okay, well, what other things live in the outside of the elbow? And of course, there's nerve dermatomes. There's dermatomes in the arm that represent different nerve injuries in different areas of the hand. And so I looked at their neck, I pushed on different parts of their shoulder, and of course, there was some pain there. And, we had some good effective treatment from treating those areas. But then I can't help but think, if I wasn't limited by insurance, what kind of view I could have of this person that wasn't just from like here down. What is that, 1/5 of our body? So, from this fascial focus, I'd love for this person to be able to come as a case study so I can zoom out and look at their whole body a little bit more, check to see what their pelvic alignment is, see if maybe the base of their spine is leading to a torsion that is leading to a twist, causing this dysfunction in the tissues in the neck and shoulder. Maybe see if there's some pain in the knee, at lateral or outside of the knee, that might be mimicking the pain in their elbow. And in the past, I have had the opportunity to do this kind of treatment with people where I can zoom out and say, hold on, you just told me you have pain in your elbow, but you've also told me however many car accidents you've been in, how many surgeries you've had in the neck and your lower back, how many other injuries you've had from sports you've been taking, however many pain medications for years, and then right before you had your elbow pain, you also fell downstairs. Okay, so let's take a little step back of what might actually be contributing to your elbow pain that's not just living in the elbow. And I would encourage some of my other fellow physical therapists to kind of like take like 7 steps back when we're looking at our clients or our patients and just really think about the person and hear what they're telling us, because they are always telling us what the problem is. We really don't have to work that hard. We really don't have to, ask 5,000 questions and just try to zone in on the elbow in this example. So when we look back at even the pelvis or even the upper neck and how these are balanced on our spine or in our bodies in space, we can almost appreciate like the soft tissue and the connective tissue holding these things in place that contribute to our posture and our function, similar to the way that like bridges are held up with tensegrity and cables and like active mobility and active stability. So, if you have somebody that looks like this and is walking around like this all day, you can imagine what that's doing for the rest of the body to try to compensate to have this person perceive that their head in space looks like this. This includes the way that our vestibular system and our balance system and our equilibrium system help to contribute. People who walk around like this perceive that their head looks like this. So that's a little tidbit I just wanted to drop from yesterday's post. So if you like this kind of content, if you think you're resonating with it, or if you're curious if there's been chronic pain you've been dealing with, let me know. Reach out, and I'd love to talk with you about your pain and things that you've experienced, and maybe the pains of dealing with our medical system as it is. It's a big reason why I try to avoid taking as many insurances as possible, because they limit you to 1/5 of your body. And if anybody has ever lived just 1/5 of their body, they know that you can't really do that. So reach out, let me know what you find fun, or if you have feedback for these videos, and I'll see you online.